Good evening, ladies and gentlemen. I'm Simran Kaur from Voice of Healthcare, and I welcome you all to a virtual panel discussion on arthritis in India, a nationwide dialogue. We would like to thank Pfizer for helping us put this series together. We have with us our esteemed guests for today, Dr. Abhishek Kumar, Senior Consultant, Department of Orthopedics and Joint Replacement, Yatharth Hospital, Senior Consultant, Virtue Clinic. Dr. Parwej Ahmed, HOD Orthopedics, Shubharati Medical College, Meerut. We welcome you all.
Thank you. Thank you.
Thank you.
My first question is to Dr. Abhishek. I would want to understand the different types of arthritis, doctor, and their prevalence in India.
Yeah, actually, arthritis vaguely is a term which is used to tell about the joint pains. Arth is joint and itis is inflammation. So, any inflammation in the joint which leads to pain is known as arthritis. And there are various types of arthritis. Like most commonest type is osteoarthritis, which is age-related degeneration of our cartilage, which leads to pain. The other common types of arthritis is rheumatoid arthritis, which is a type of autoimmune disease, and it is prevalent in younger age groups as well. Other common arthritis is gouty arthritis, reactive arthritis, which is very common these days. I'm seeing many patients with reactive arthritis in my OPD. People are having dengue, and after that, they develop this reactive arthritis. In response to this fever, like dengue, chikungunya, or any viral fever, we develop antibodies and they are deposited in the joints. So, I just wanted to highlight this because this is very common these days. Next, other types is post-traumatic arthritis, like after any injury, the cartilage may get damaged, and that can also lead to joint pains. So these are fairly common types of arthritis. And if we talk about the prevalence, vague figures are there. Worldwide, 260 million people are affected. In India, I mean, the Uttar Pradesh is having the most burden of the society, and more or less, this is prevalent more in the rural population than in the urban population. So, I mean, this is the prevalence of the arthritis. It is fairly very common.
Right, doctor. Thank you. Moving to Dr. Pravez, while Dr. Abhishek spoke about the types of arthritis, I would want to understand the symptoms of arthritis from you.
Dr. Abhishek already tell about the various type of the arthritis, just like in two categories, mainly inflammatory and the non-inflammatory arthritis. Dr. Abhishek already told about the osteoarthritis. Osteoarthritis, the various symptom usually occurs more than after 40 or 40 years of the age. The commonest symptom of the osteoarthritis is pain, swelling, and deformities. But in rheumatoid arthritis is more common, yeah, just like of another type of the arthritis, just like of inflammatory and rheumatoid arthritis is most common morning stiffness and they wise increase with the morning stiffness and the crystal induced just like of gouty arthritis is an individual pain at the metatarsophalangeal joint of the first meta with pain, redness, and the other symptoms. And the rheumatoid conditions, various type of the deformities, mostly on the proximal interphalangeal joint and the metacarpophalangeal joints. But in the psoriatic arthritis, it usually occurs with the distal interphalangeal joint. So various type of the symptom and various type of the deformities occurs with the different type of the different. It may be the monoarticular It may be the polyarticular. Monoarticular, variously most common is a non-inflammatory is osteoarthritis, and inflammatory is most common is gouty arthritis. But polyarticular arthritis, where is the occurs just like of the rheumatoid arthritis in the ankylosing spondylitis. And ankylosing spondylitis and rheumatoid arthritis, where the synovium and the any joint where the synovium occurs is be effective. In ankylosing spondylitis, mainly the axial skeleton, sacroiliac joint and the lumbar spine, where the stiffness and other type of the crippling type of the disease will occur. And the different type of the different arthritis present different way.
Right, doctor. So, how do we go about the diagnosis and the treatment for the same?
The diagnosis against first of all we go the routine investigation. Routine investigation mostly inflammatory marker. If the clinic first you of all you assess the clinical status of the patient and clinical evaluation. Just like a rheumatoid various terminology, American Rheumatology Association and ULR gives the guideline for the clinical diagnosis. And against with the ankylosing spondylitis, against with the clinical diagnosis. There then only the inflammatory marker, and before the symptom will be occurs, anti-CCP antibodies will be positive in rheumatoid arthritis. So rheumatoid factor in rheumatoid arthritis, it either is a seropositive or either is a seronegative. Where the rheumatoid factor is positive or rheumatoid factor is the negative. The rheumatoid factor is the positivity is in 75%, but anti-CCP is a highly sensitive factor. Against just like of ankylosing spondylitis, HLA-B27 is highly factor. If there is an just like of septic and another, you give the synovial evaluation in the form of the cytological and the biochemical investigation with the synovial fluid examination. Where is the total count and the protein and another factor either is a transitive or exudative.
Right, doctor.
Or if
Thank
there
you.
is an advanced, we go the X-ray of the individual joint, where is the affected occurs or not.
I think there's some technical glitch at doctor's end. Moving on to Dr. Abhishek, could you briefly talk about the medical and the lifestyle approaches for managing arthritis, doctor? Over to you.
Yeah, if we are talking about arthritis, as we know, the most common type is osteoarthritis. Osteoarthritis is usually seen in people more than 50 years of age, and there are few risk factors which we need to identify, and I mean, we should try to prevent the prevalence, the incidence of the osteoarthritis. So, if we talk about the risk factors, the most common risk factor is obesity. So, if our body mass index is above 30, we should always try and motivate the patient to reduce the weight. I usually tell patients to stop eating sugars, stop taking milk for some time, and milk products. And if we eat early in, I mean, if we take early dinner, that will also help us to reduce our weight. And I have tried intermittent fasting in many of my patients, which is very effective method. In this method, we tell patients to take early dinner at around 7 p.m. and then break their fast in the morning after 9 a.m. So that will help to reduce the weight. Second lifestyle modification is exercises. As we know, the knee is the most common joint involved in the osteoarthritis. So, if we exercise our knees, especially our quadriceps muscle, which is the muscle which is in the front of our thigh, if we do a quadriceps exercise regularly and avoid squatting and avoid sitting cross-legged, especially in people after 60 years of age, then we can uh, prevent osteoarthritis. So if we come to the treatment part, suppose the patient is already having osteoarthritis, we should always stage any disease. So depending on the stage of the disease, depending on the clinical as well as radiological X-ray wise, if it is an early osteoarthritis, we should try a few anti-inflammatory medicine to reduce the swelling around the joint, and that will also relieve the symptoms of the pain. And then promote exercises, reduce the BMI, and we can start few chondroprotective drugs, which also helps to reduce the pain and symptoms. Once the pain is reduced, the patient will develop a confidence, and they will also start taking care of their knees. But on other hand, if the patient is already in moderate stage of osteoarthritis, then we may have to give few intra-articular injections, and which may be of some kind of lubricant, or sometimes we give a low dose steroid, which also reduces the inflammation around the joint. These days we are also giving uh, platelet rich plasmas and a few growth factor extracts. They also help to reduce the inflammation, pain, and also they promote, I mean, they are supposed to promote the cells of the cartilage. So I have seen few results. They also help in reducing the pain. When the patient comes presents to us in advanced stage, and the osteoarthritis is already beyond, I mean, and the pain is so severe that it is affecting the daily living, daily activities like walking, even for 500 meters, or I mean, it is affecting the daily activities even in the room, in the, I mean, in the house. So in that stage we may have to think about the surgery. Surgery may be, if it is still early osteoarthritis, we may have to try medial opening wedge osteotomy. In this, we cut the bone and try to straighten the deformity. And in advanced cases, the only option left is total knee replacements. So this total knee replacement is a kind of surface replacement, where the surface of the bone is covered with a metal, and this is a very safe and very prevalent. I mean, and with very good results these days. And now even people from rural population also are getting the total knee replacements done. And these days we are also using robotic for the accuracy of this. Yeah. So this is grossly the treatment which we do in osteoarthritis.
So you spoke about the treatments, doctor. I would want to understand, are there any advancements or innovative treatments that you would recommend people to explore?
Yeah, as I told you, if we are talking about the non-surgical part, the advancement is like growth factor extracts. In this, we take the blood of the patient, around 4 ml blood is taken out, and we put in a kit which will disintegrate the blood, and then we centrifuge this blood for around 15 minutes. This will separate the plasma. This plasma will have growth factors, and this growth factor is supposed to enhance the cartilage healing. And we are using this, and this may become a very prevalent technique in the coming times. Other advancements is unicondylar knee replacements. Those patients where the knee osteoarthritis has advanced, but not to such an extent that total knee is supposed to replace. In such cases, we replace only one part of the condyle, one part of the knee, and this is also a recent advance in the knee replacement. So, I mean, but still, it is best to prevent a osteoarthritis by doing lifestyle modification, by educating people, rather than going for a knee replacement later on. So if the public is aware of that, how to prevent a knee osteoarthritis, that will be more useful.
Thank you, doctor. Moving on to Dr. Pravez, it is better to prevent arthritis, like doctor mentioned. So,
Yeah.
how to prevent it and how to manage it in a patient's daily life is something that we would want to understand from you.
Already Dr. Abhishek tell about the osteoarthritis for the prevention and the management. And the already Dr. Abhishek tell about the various type of the modalities of the osteoarthritis, just like a partial replacement and SNP and the plasma. But on the community base, how to prevent to the osteoarthritis, not of the inflammatory arthritis. Inflammatory arthritis is an immunological factor. Never be preventive, always you treat it. But how to prevent it? To prevent the basically to modified of la- um, mm, the various type of the education and modified the lifestyle. Lifestyle modification is very important. Dr. Abhishek tell about the obesity. To reduce the obesity, how to reduce the obesity already tell the before fasting and the various type of modalities. Take the dinner before 7 p.m. And the education on the basis of the community level, how to educate the individual, how to prevent it, the various type of the prevention, just like if you prevent the stress factor, and the stress is more important for the osteoarthritis, and the stress relieve various type of the modalities, just like of education and the community basis, daily living life of style, various modification. Dr. Abhishek tell about the preventive method of the osteoarthritis. But when there is an inflammatory arthritis is occurs, never be preventable, but the basis of the various type, until and unless the panicity and the permanent disability will be occurs. You prevent the panicity or the panic attack of the, just like of the rheumatoid and various type of the gouty arthritis, which give the permanent damage. So must be reduce the inflammation and the various type of the drugs which give the permanent damage to the joint. And the most important is if there is an acute, the corticosteroid must be given until and otherwise the patient goes into the permanent damage of the joint. So my suggestion is the lifestyle modification, education, reduce the weight, all are preventable causes of osteoarthritis, and the daily
Right,
physiotherapy.
right, right, doctor. Thank you. Dr. Abhishek, how does arthritis affect the vulnerable population, such as the elderly or those who have limited access to healthcare?
I mean, yeah, as I told you that in India, osteoarthritis is more common in rural population, though we may be thinking that it is more prevalent in urban population, but maybe because of lack of knowledge or awareness about the osteoarthritis and other arthritis. In rural population, we often think that this is part and parcel of our life. Suppose a patient is having polyarthritis, having small joint pains, and I mean, actually, he or she may be having rheumatoid arthritis, but because of the lack of facilities in the rural population, because of the lack of testing facilities as well, so we often ignore and we are we may miss the diagnosis of rheumatoid arthritis. Rheumatoid arthritis, if it is not diagnosed early, it may cause permanent damage to our joints, which may lead to deformities. And I mean, once these deformities have developed, then it cannot be reversed. So it is very important to educate the rural population by some means. Maybe you can also contribute by doing some programs and to educate the rural population about the symptoms of such diseases, and if they are aware, they may, I mean, get it tested. Even testing facilities can be can be made available in the form of camps in such areas, and if such prone population can be identified and they can be tested. Mobile X-ray vans are also available, and they can be taken in the camps to the rural population, and standing X-rays of the knee of the elderly people can be done to identify and stage their osteoarthritis. They should be educated not to use the Indian style of, the toilet. Instead, they should be promoted to use the commode ones so that the squatting can be avoided. That is also important to prevent the progression of osteoarthritis of the knee joint. So, I mean, government, the NGOs, and we doctors should take initiative by organizing camps in rural area, and they should we should educate the people and take corrective measures at early time.
So, Doctor, we spoke about the education and the camps that should be there in place. But are there any programs or initiatives that are already, there and people are aware of it to cater to these needs of these people?
I mean, there are government hospitals, there are government facilities, but I mean, the main issue is the awareness among the people to take the initiative to visit in if such symptoms are there. So I mean, we can circulate few WhatsApp messages. I mean, these WhatsApp messages, instead of having, uh, I mean, those stuffs, we can circulate few videos which are related to the healthcare, especially arthritis, and they can they in their language. I mean, that is also very important uh, to reach the mass in their own language, rather than, uh, educating with difficult terms which they are not able to understand.
Right. Dr. Pravez, would you like to talk about any preventive measures or any sort of health initiatives that are already there in place to raise awareness related to arthritis?
The various awareness program can be held in our institution, just like of various program to make the healthy bone and healthy joints. And healthy bones and healthy joints is the most important factors for the community based and other individuals, just like of physical activities and the various education uh, for the health purposes. So my institution gives the every Saturday's program in our institution in the form of the physical therapy and the physical camp to reduce the pain and disability of the various type of the joint and the others, and to make the healthy bone and the healthy joints. The program of every Saturday and every last month of Saturday, the community-based program on the basis of the district level or on the basis of the block level of the community-based program.
Right, doctor. So, Dr. Abhishek also spoke about how we can circulate WhatsApp messages, and he spoke about technology basically. So, how can technology be used to create awareness related to arthritis?
If in the on the basis of the WhatsApp to gives the small videos and gives the along with the disability patients how what features of you are if you are not taking of the care of yourself. So various type of the videos to make on the WhatsApp and circulate to the community. So what is the your future? After the 40 or after the 50 years of the age. There are various type of the crippling disease and the deformities and the various and the burden to the family and burden to the countries is very high of the various type of the arthritis. Just talk of the osteoarthritis and the inflammatory arthritis. Just one patient sees with the ankylosing spondylitis, neither see forwardly, neither see upwardly, neither lay down, and the individual neither you do the cross leg, neither you do the sitting, and the disability, and this disability type of the sort of the video circulate to the community, and to educate the community, okay, what is the your future if you are not properly educate the yourself, and and not do the physical activities properly, so what your outcome this occurs. So the media is very important play role for the
Right,
community
doctor.
based program.
Right, absolutely. Thank you. Moving to Dr. Abhishek, how can individuals with arthritis become advocates for themselves as well as others?
I mean, a, a person who is suffering is the best judge of that problem. And I mean, a person who is having knee pain can explain the best about his problems. And initially, the person tries to, I mean, manage the pain by himself, try to learn from the internet, and from YouTube is also a common source of knowledge for them. They uh, they try to initially treat themselves, and then finally when they're not able to get rid of the pain is the main important uh, feature which God has given us. I mean, if there was no pain, the patients would have suffered more. So this pain gives a signal which the patient as well as doctor will try to find out the reason for it and then treat accordingly. So I mean, we should take early intervention whenever a person starts having pain anywhere. If we are talking about arthritis, if I would like to tell everyone that if you are having pain in your hand joints, especially these small joints of your hand, small joints of your feet, if you are having back pain, if you are having uh, early morning stiffness, if you have your family members like mother, father, sister, or I mean cousins are having uh, uh, similar symptoms, and they are known case of rheumatoid arthritis, one should always try to find out whether you are having rheumatoid arthritis and treat accordingly. And one should always meet your doctor because they are the best judge. We cannot learn everything on internet and start treating. Many of my patients, they try to treat themselves and sometimes they are in trouble. And sometimes the disease is so delayed due to negligence, due to I mean, due to sometimes financial things, that it is very difficult to manage afterwards. In initial stages, any disease and arthritis can be prevented, can be reduced, and its progression can be slowed down so that your future life becomes better. So we should all be aware and should always consult our doctor rather than treating ourselves.
Right, doctor. So apart from developing a pain, what are the other symptoms that a person should take into account and then visit or consult a doctor? When is the right time to visit a
As,
doctor?
as I told you, morning stiffness is a feature of morning stiffness which lasts more than 30 minutes is a characteristic feature of rheumatoid arthritis. Other features are polyarthritis, more than three joints are involved, hand joints are involved, your, I mean, having uh, weakness, tiredness during the daytime. These are characteristic symptom of rheumatoid arthritis. If we are talking about gouty arthritis, gout is because of the increase in the blood uric acid levels, and these blood uric acid levels, blood uric acid can get deposited in the form of crystals in your joints, and one of the few common joints is base of the toe. And at that area, if you are having redness, if you are having pain, swelling in that area, that is a characteristic symptom and sign of gouty arthritis. If we are talking about psoriatic arthritis, we should always look for the skin patches, lesions in the skin, which uh, which will tell about the psoriasis. And then that joint pain can be correlated with that patch, and it is uh, psoriatic arthritis. Osteoarthritis is usually presented in elderly age group, and very few people in 40 to 50 are also affected with the osteoarthritis. Post traumatic, we should always look for any history of any trauma which may have led to this arthritis. So, I mean, there are other symptoms like common symptoms are restriction of the range of movement, that is stiffness of any joint can can be a, I mean, common feature of arthritis. Then there some, I mean, in elderly age group, we often see that there is a sound which comes, that crepitus, a crackling sound which comes from our knees. So that is a characteristic feature of osteoarthritis. Bowing of the knees is again a common feature, while the reverse bowing, that is the knock knees, can be a feature of valgus deformity, we call it, is a common feature in the rheumatoid arthritis. So, I mean, most of the doctors and orthopedic doctors, rheumatologists, they are aware of the symptoms, and but you should reach them early so that they can act early.
Right. Thank you for that insight, Doctor. Moving to Dr. Pravez, can you discuss about the support systems and the resources that are available for individuals to lead a fulfilling life even while having arthritis?
Again, one thing I missed previously about the avian hip, and which leads to the arthritis. Of the younger individuals, involvement of the hip is very high because of the supplementation of the protein powder and in the gym to build up of the muscles. And this the 20 years old male and 22 years old person may develop say hip arthritis. And the to avoid of the protein supplements and another in the gym trainers and all the prescribed thing is avoidable during the gym, and the dietary supplement is the most important of the your thing. And the dietary supplements in the form of the calcium supplementation and vitamin D, which is the need for our and the protein and the supplements which circulate to the society is basically is avoidable. And there is an adulteration of the food in the form of the junk food, and this also lead to the osteoarthritis. And the avoidance of the junk food to take the healthy food and the healthy usme and the take the proper sleep and the early morning physiotherapy and the early morning walk, which is helpful for the benefit of the bones and the joints. And the preventable and the supplements in the form of the calcium and the other thing and the healthy foods in the form of the proteins and the other, just like of the small fats and the carbohydrate, not of the excessive, which gives the overweight to the individuals, which leads to the joint damage and the finally lead to the arthritis of the joint. To prevention of the rich carbohydrate and the fat diet and avoidable and the additive of the protein diet is in the form of the various form, in the form of the protein, milk and the other, and the junk food avoidable in the form of the just like of the alcohol, excessive tea, all are which damage to the bone and the joint.
Right, Doctor. Thank you. Uh, Dr. Abhishek, I would want to know about your thoughts on the topic and your message to our viewers.
I mean, uh, I would like to say that one should not be afraid of arthritis. Arthritis is part and parcel of our lives. Everyone, today or tomorrow, me, you, and everyone will have to, I mean, go through the phase of arthritis someday. But if we are aware, if we are exercising, if we are eating healthy, if we are preventing our osteoporosis, which is the base of our cartilage, if our bones are stronger, and we are doing a regular walk of around 30 minutes. So if we are not allowing uh, our body mass index to increase in this manner, we can prevent osteoarthritis. And I mean, even if we develop it, if we start the treatment early in the form of few medicines, sometimes injections, this can be prevented. But suppose someday it has progressed, then also it is not the end of life. Post knee replacement, many of my patients, thousands of them, they are walking confidently for kilometers, and life after knee replacement is also not bad. So one should not be worried so much and should not be afraid of this disease. Though we should always try to prevent and try to fight, reduce this, and also teach our, I mean, help others also to get rid of it, to overcome from this disease. And I always try to tell my patients to tell at least 10 other patients, 10 other people, learn, teach them the exercises which I tell them in my OPD, so that the awareness, at least they should go to the society. Thank you.
Right, doctor. So, just a follow-up question. You spoke about that life is not that bad after knee replacement as well. But what are some of the measures that one should take after they have gotten a knee replacement? If you know that is the only solution and if they've gone for it, what are some of the steps that they should be taking?
Yeah. Knee replacement is a, as I told you, it's a very rewarding surgery. That's why it is so prevalent. And if the person who underwent the knee replacement is taking care of his or her knee uh, in the form of exercises which are to be done after knee replacement, then they can I mean take care of the knee replacement, and the knee replacement will be successful for more than 25 years in some cases. But if we are not following the instructions, like we are squatting, we are sitting cross-legged, and we are not exercising, we are not taking care of our osteoporosis, then the life of the knee replacement may reduce to less than 15 years. So again, we should eat healthy, do exercises. One should not squat, one should not sit on the floor. And another important aspect is prevention of fractures after knee replacement. So a person having fracture and a person with a knee replacement having fracture is different. So periprosthetic fractures, we call, is a difficult situation to treat. So I would request my viewers to prevent such fractures by having proper lightning in your household, in, and you should use non-slippery tiles in your washrooms. One should always have few handle supports which will help you to prevent the fall. So, after any joint replacement, one should always keep in mind that if you fall and if you get a fracture, then it will become a difficult job for us and the patient to manage it. So, for a successful knee replacement, one should avoid falls and do measures to prevent such falls.
Right, doctor. Thank you. Dr. Pravez, your closing thoughts on the topic and your message to our viewers.
My message is to make the quality of life, and how to improve the quality of life in the form of the way, if there is a need of the drug, you take the drug. If you consent to the doctor, you consent first of all doctor, and take the proper advice. Never thoughts about the WhatsApp message, YouTubers, and nothing else. You consult your doctors first, and to make the quality of life. If there is need of the knee replacement, you do the knee replacement. If the deformities and other things. If you need of the hip replacement, you do the hip replacement. If you need of the steroid, you take the steroid without taking any hesitations. And the never thoughts and the myth of the various type, never take the stand, I not take the analgesic, nothing else. But for the quality of the life and for the further damage of the joint, you take the analgesic, you take the proper rest, you take the physical activities. If need of the intervention, just like of replacement of the knee replacement on the, you do the things for the better quality of life. Never becomes the life immeasurable or the damn to the things, you becomes an depressive and later on develops a permanent crippling disease. Before the crippling disease, you do the co- uh, proper exercise, taking healthy foods and the other things. If you need the treatment, you take the treatment
Right,
and
doctor.
consult your
Thank
doctor.
you. Thank you,
Thank
doctor.
you.
Thank you for this insightful session. And by with this, we come to an end of the session. Thank you so much.
Thank you.
Thanks. Thank you for the
Thank
session
you,
and
Dr.
inviting
Abhishek.
us.
Bye.
Thank you, Dr. Parwej. Nice meeting you.